Liposuction can do a lot. It's changed since being brought to this country by Dr. Louis from France in the early 80s and late 70s. It was a very bloody procedure then, and now it's really evolved into a much more specialized technique that works very nicely, actually. So essentially what we're trying to do is reduce the area that the patient wants reduced. In other words, like a saddlebag or a love handle that's made up of fat underneath. So we're trying to suction the fat out and let that come down so it looks a little bit better. There are other times that we use it to debulk a patient. Let's say their thighs are so big that if you liposuction them a lot, they'll look ugly afterwards, but we're preparing them for a thigh lift. So we will debulk them with liposuction, and then we'll later go back and cut out the excess skin. It's used in the face. We will liposuction the neck. We even liposuction jowls. We liposuction lipomas. The lipoma is a fatty tumor. So there are lots of areas that we use it for. Typically what I do, and what most, I think, plastic surgeons do, is called the tumescent liposuction, where you inject fluid first into the area that you're going to liposuction. That has some epinephrine, which vasoconstricts the vessels, which means shuts them down so you don't bleed a lot. And then you use multiple different size cannulas, whichever you think is appropriate, to suck it out. And there are different machines that you can use for it. I actually use a machine that vibrates a little bit, and that helps me physically, because it's a very physically demanding procedure. I think it probably helps reduce the fat a little bit better as well, but it certainly helps me. The procedure of liposuction and how long it takes is dependent on how much you're doing, essentially, what areas you're doing. Sometimes it takes me 4 to 6 hours. Sometimes it takes me 30, 35 minutes. If I'm doing a small area, then it's really quick. And the recovery is quicker as well. So the bigger the area that you liposuck, the longer the recovery. The pain medication is used for up to 2 weeks after surgery to really help the patients get around and to comfort them for those 2 weeks. Then thereafter, you usually don't need anything.